on this rainy South Florida afternoon. I'm Dr. Wegerif here at Pure Plastic Surgery, and I want to invite all of you to go check out our brand new website that we just did a lot of work on. Willie, the man behind the camera, did a ton of work on, and it's really an upgraded, great, beautiful website with a ton of information on it. So if you have any questions, I bet you can find the answers there, but of course we're always available if you want to reach out to us, and we'll answer those questions for you. So today we're going to be going over recovery from breast surgery and post-operative care for breast surgery. So the first thing to understand about breast surgery is that it's actually really well tolerated. Almost all the procedures we do for breast surgery from a pain standpoint is very well tolerated. The one thing that's a little uncomfortable for patients is often when we put implants underneath muscles for the first time, because this gives you a feeling of tightness. And so for all of my patients, in addition to the pain medicine that we give you, I also give you a muscle relaxer, something called Flexeril. This really helps with the discomfort associated with the implants being underneath the muscles for those first few days after surgery. And so a lot of my patients really don't even need to take their pain medicine, and they use more of the Flexeril and Tylenol, ibuprofen, that kind of stuff after surgery. The biggest thing to keep in mind with any surgery you get is just following your surgeon's instructions. So I know a lot of people tune in that may not be getting surgery with me, but every surgeon has a little different policy on when they want you returning to activities, when you can shower, and doing all these different things. And it's really important for you just to follow whatever your surgeon's advice is for you. But for breast surgery, like I said, pretty well tolerated. Pain's not that bad. You're moving on to non-narcotic pain medicine within just a few days of surgery. And then we have to start talking about the recovery process. And it's a little different for different procedures. For breast reductions and breast lifts, those are very well tolerated. Pain's very minimal. And you're basically just need to heal up at that point. There's not any settling of the implants that we need to really stay on top of. It's just making sure your incisions stay closed and you're able to heal and progress on. So for the first 2 weeks, really pretty limited activity. We don't want you stretching your arms up high over your head because that can put a lot of stress on the incisions. So you can go up to about shoulder level with your elbows, so you can still wash your hair, brush your teeth, that kind of stuff after surgery, just not going straight up over your head. For procedures that involve implants, it's really important that you follow up with your surgeon and follow up as scheduled, because sometimes implants can settle at slightly different rates. And there's things we can do to encourage them to settle evenly if one's dragging behind a little bit. That can include massage for the implant or wearing a band that helps them just settle evenly to get the best result you can get. When it comes to returning to exercise, I'm okay with all of my patients starting light cardio, low impact stuff. I don't want you jogging or anything that's gonna be pounding the pavement at around 2 weeks. So if you wanna go through a walk through the neighborhood or go, sit in a sit-up bike where you're not holding yourself with your arms, I'm fine with that around 2 weeks. And then you can progress to, more normal gym exercises around 6 to 8 weeks. But for all the patients that have implants below the muscles, below the pec muscles, you really want to avoid exercises long-term that focus on the pectoralis muscles. So things like push-ups, burpees, bench press. You really kind of want to avoid those. So that's why we offer different options to different patients. You can get the subfascial technique or submuscular technique, and we'll talk about that all during our consultation. And then in terms of managing your scars and your wounds, after your steri strips come off, you want to use the Silogen gel that we prescribe or silicone tapes over all the scars. This will help keep them nice and flat and smooth. And you want to avoid any sun exposure on those scars, because that'll make them more pigmented than they need to be if you're able to avoid the sun exposure. And then lastly, just maintaining the results long-term for your breast surgery. Gravity does not stop for anyone, and that includes your breast. So especially if you go with a larger implant or something like that, you really want to wear a supportive bra as much as possible, because that's going to take some of the stress off of those tissues that are holding those implants up. And so wearing a nice supportive bra as much as possible. If you go out to a nice dinner or you're hanging with your loved ones and you want to show off your breasts, you're free to do that and take the bra off, but when you're just lounging around the house, if you want to maintain your results as long as possible, it's a great idea to wear a supportive bra as much as possible. With all that being said, does anybody have any specific questions for me for the recovery process of breast surgery?
Okay, first question, Doc. Well, says what's your max BMI?
BMI is 34 here at Pure Plastic Surgery for me.
Okay, and this is a comment, not a question. Very handsome, Doc.
Well, thank you.
I wear mine to bed at times.
You wear your bra to bed at times? I think it's a really good idea. Again, it's going to help maintain those results long term, and it's a nice, comfortable bra, but something that gives you a little bit of support.
Okay, how long before I can bath or shower? How long after breast augmentation?
48 hours after surgery, you can start showering. I don't want you submerging in any baths or pools for at least 4 weeks after surgery to make sure everything is healed up and nice.
Okay, the question is for a lift. How soon can I go back to work?
It depends what you do for work, but if you work a desk job and you get just a breast lift, most patients are going to feel good enough to go to work the following week after surgery. If you work a labor-intensive job where there's a lot of moving of your upper extremities, you're going to wait about 6 weeks.
Okay, we have a question here at TikTok asking about the age limit and if 66 is still age to reshape breast.
It absolutely is still an age to reshape breast or get breast surgery, and it can be very safe at that age. We have some policies in place here at Pure Plastic Surgery because we're an outpatient operating place that is not within a hospital, and we like to limit our patients to 60, 62 years. If you want to reach out, I'm happy to review your file. If you're super healthy, we will consider doing someone around that age, but anyone older than that with any comorbidities, we like to recommend you get surgery at a hospital.
Okay, Doug, how soon will my implants drop into place?
That's a little different for everybody and depending on what technique you use, but you don't want to be prematurely judging the results of your breast until you're at least 6 months out from surgery. And then if there can be settling that goes up to 6 months, even a year in some cases. But there is a window where if one implant is settling faster than the other right after surgery, that we really want to encourage massage or using a band to get that other side to fall before the healing really takes place around the implant. So it's important to follow up regularly with your surgery during those first. How much liposuction we can do, which really comes down to volume of liposuction. So we could do all of those areas as long as it's under our 4-liter limit in the outpatient setting, but we can't do that when combined with a big cutting procedure like a tummy tuck. So when we're doing a big combined cutting procedure like a tummy tuck or a breast reduction or something like that, it needs to be less than 1 liter of liposuction. So it's kind of a case-by-case basis.
Okay, those are 3 questions from the same patient, but it's the same thing at all. It's like, I am 9 months post-op and I feel my tummy so hard and I feel normal.
How far post-op?
9 months. She asked if it's normal and she also has the area numb.
Okay, so feeling tight 9 months after surgery is still not an uncommon thing. We tighten up your muscles. It's common to still have a little bit of a feeling of tightness. Numbness is also common to have. Usually around the 1-year mark is when your sensation will return, and anything that hasn't returned at that point probably isn't going to get much better. But we are cutting through some nerves when we do a tummy tuck, so numbness is a thing. The bulge, I would have to examine you to see what that is. It could be a little area of fat necrosis, or it could be a small hernia, it could be a bunch of different things. So it could be something that's not super concerning either, but I would need to examine you to give you more information. All right, please everybody go to the website, check us out at pureplasticsurgery.com and reach out for a consultation or any additional information. There's a ton of resources there now, and I will see you guys all next week.
Okay, but remember one thing, the flash sale until tomorrow.
We have a flash sale going until tomorrow, so go check out the website for more information.
That's great. And one last question just came in, and it's about exercise and driving. This is a patient that will have surgery in 3 weeks with you, and she asks, when can I resume driving and exercise?
So driving, my criteria for when you can resume driving is when you are no longer taking narcotic pain medication and your pain is controlled to the point where you could turn your wheel sharply or slam on your brakes. So for some patients that's 1 week, for some patients that's 2 or 3 weeks, okay? And then
Exercise?
Exercise?
Yes.
Plan on 6 to 8 weeks after surgery for full return to exercise. All right, everybody, have a great day.
Thank you. Boom, boom, boom. And